Let's talk about Pheochromocytomas and Paragangliomas. The adrenal glands are like top hats on the kidneys, and their job is to produce different kinds of steroid hormones, most notably cortisol and adrenaline. These hormones are necessary for life because they regulate stress responses that control blood pressure as well as how our body uses glucose. Now, because we do so many CAT scans on people for other reasons, we often find nodules in glands by accident, and these are called incidentalomas. Very rarely, one of these nodules could be a pheochromocytoma. What is that? It's a very rare adrenal tumor. It only makes up 4 to 7% of all adrenal tumors, and it's almost always benign. These tumors can unpredictably release large amounts of stress hormones. Patients may report spiking blood pressures, palpitations, anxiety attacks, but sometimes patients don't have any symptoms at all. When the tumor makes enough stress hormones, the adrenal gland on the other side kind of goes to sleep because there's already so much hormone around. How would you know if your adrenal tumor is a pheochromocytoma? We screen every adrenal nodule for pheochromocytoma, even if it doesn't really look like one. This is usually done by collecting urine for 24 hours and checking it for compounds called metanephrines, or catecholamines. For certain cases, we may check a blood test instead of that urine test. What if a patient doesn't have any symptoms? Why should they even care about a pheochromocytoma? Even when this kind of tumor doesn't produce noticeable symptoms, it is taking its toll on your body. We want to remove these tumors to reduce your risk of long-term heart problems and stroke. So how is a paraganglioma different from a pheochromocytoma? The paraganglioma is a cousin of a pheochromocytoma. They both make unpredictably large amounts of hormones, and they both cause long-term problems if they are not removed. The only difference is that a paraganglioma isn't located in the adrenal gland. It's found alongside certain nerves in the body. If you have a diagnosis of pheochromocytoma or paraganglioma, now what are you supposed to do? Well, now we get ready for surgery. The surgeon must be very experienced with taking out these specialized tumors, so frequently this will be done at a large university teaching hospital, and it is a process that takes a long time. In phase 1, we start medications called alpha blockers. This is like phenoxybenzamine or doxazosin to start getting the patient ready. This can take several days to several weeks. Phase 2 happens once you've gotten to the optimal dose of alpha blockers. You will start beta blockers as well. We use both drugs to prevent the body from reacting to the extra stress hormones that the tumor makes. It's very important that beta blockers are not used until after the alpha blocker dose is optimal. In phase 3, the patient is admitted to the hospital prior to surgery. They get lots of IV fluids and a high salt diet. We want the patient to have strong blood pressure before starting surgery. Phase 4 happens in the operating room. The surgeon tries not to disturb the tumor too much while it is being removed because the tumor can react. It can, for lack of a better term, kind of panic and flood the body with huge amounts of stress hormones and adrenaline. The anesthesia team will control the blood pressure and the heart rate during the surgery. In phase 5, after the tumor is removed, the body suddenly doesn't have enough stress hormone or adrenaline because those adrenal glands had kind of gone to sleep. The blood pressure can go very low. Usually patients need to recover in the intensive care unit where they can get specialized medications that will keep the blood pressure up while we wait for the other adrenal gland to wake up. And then what happens after surgery? Then patients can return to their normal life. Usually after everything is over, they feel so much better, they need fewer medications, and some will say they didn't even realize how badly they felt until they discovered what normal really was. You will see an endocrinologist periodically to observe the recovery. When you have questions, here are some resources to check that will be reliable, up-to-date, and easy to read. First, there's the Columbia Adrenal Center, which has a whole section about Pheochromocytoma and Paraganglioma. And there is the Endocrine Surgeon Group, which has sections about both of these tumors, as well as the Mayo Clinic, which has multiple sections about benign adrenal tumors, pheochromocytoma, neuroendocrine tumors, and paragangliomas.